My name is Dr. Rihanna Broadwater. I'm a third-year family medicine resident here in Columbia. I chose Prisma Health Family Medicine residency program in the Midlands because when I interviewed here, I just had a family feeling about it. The faculty, the staff, the residents, even the patients are genuinely kind. And Columbia is such a beautiful place to live in. There's such a lot of fun things to do indoors and outdoors. So I would describe the culture of Prisma Health Family Medicine residency program in 3 words: autonomous, inclusive, and nimble. We've had to make some changes, especially for COVID, and so it's good to know that you're a part of a program that's willing to grow as the world and the rest of us kind of grow through this together. I feel like I've received a valuable education based on my peer accolades, based on my patient reviews, and of course my board scores.
Hi, I'm Matt Nodelman. I'm the Residency Program Director here for our Family Medicine program in Columbia, South Carolina. The goals of our residency program are to train really high quality, well-rounded family medicine doctors. And one of the things I'm most proud of is the diverse number of things that our residents are able to do after they graduate. One of the big goals is having residents go and be able to serve patients in underserved areas and professional shortage areas that are in high need, and be able to take care of any needs that patients have in those settings. The people and culture, kind of best define the experience that our residents have, and I think immediately when you walk in the halls of the Family Medicine Center, you can feel the supportive, passionate, innovative family environment that we have, and I think that residents and faculty alike bring that to the table every day to lead to the best experience and the best care of our patients. Some of the unique aspects of our program are being able to work in a busy community hospital, but also have strong academic affiliations with the University of South Carolina. So what that means is our residents have a high volume of patients, they have a lot of pathology that they get to take care of every day, but they also have access to technology and resources through the university that help them in their practice. That includes working collaboratively with some of our fellowship programs like sports medicine, global health, and palliative care, as well as using point-of-care ultrasound, where I feel like our program has always been on the leading edge of integrating that into our clinic and in a hospital setting.
My name is Michaela McElveen. I am a second-year family medicine resident here in the family medicine program. I went to medical school here as well, and I decided to stick around. I think that the Prisma Health partnership with the School of Medicine has been a tremendous asset to my own education. Having gone to medical school here as well as attending residency here, the access to the sheer number of specialists that we have and I guess the size of the Prisma Health organization just gives us a lot of variety in the clinical things that we see each day. Diversity, equity, inclusion are central to ethical patient care, I think. Most of my patients have had very different life experiences from me, and I think that it's really hard to come up with a good plan of care for someone without understanding their background and their lifestyle and their values. And so I try to keep those things in mind with every patient and every decision that I make. In terms of autonomy that I've gotten as a second-year resident, of course, as a first-year resident, I had to run everything by an attending, which is reasonable, responsible thing to do. But moving into this year, I felt a lot more comfortable with coming up with my own plans of care for each patient. And I love that I do have the attending on standby, obviously, if I have any questions or anything goes wrong. But kind of branching out on my own and challenging myself to make my own plans of care for each patient has been an essential part of becoming who I am as a resident physician.